LPN NCLEX Review 2026 Nursing Practice Test and Study Guide, 25 Essential Questions. Question 1. Which of the following is a legal document that allows a person to describe their medical wishes when they can no longer speak for themselves? Informed consent, advance directive, incident report, nurse's note. Advance directives, like living wills, outline a patient's preferences for care if they become incapacitated. Question 2. A nurse is caring for a client with C. diff. What is the required hand hygiene? Alcohol-based hand rub. Washing with soap and water. Wearing gloves is enough. Wiping with a dry towel. C. diff spores are resistant to alcohol. Hands must be washed with soap and water to physically remove the spores. Question 3. What is the normal range for an adult's respiratory rate? 8 to 12 breaths/min, 12 to 20 breaths/min, 20 to 30 breaths/min, 10 to 15 breaths/min. The standard normal respiratory rate for an adult at rest is 12 to 20 breaths per minute. Question 4. A client is scheduled for surgery and has not signed the consent form. The nurse discovers the client doesn't understand the procedure. What should the nurse do? Explain the procedure to the client. Notify the surgeon that the client needs more information. Have the client sign anyway. Ask the family to sign. The surgeon is responsible for providing the information for informed consent. The nurse should notify them if the patient is confused. Question 5. Which of the following is a sign of dehydration in an elderly patient? Increased skin turgor, confusion and dark urine, bradycardia, hypertension. Elderly patients often show confusion, poor skin turgor, tenting, and dark, concentrated urine when dehydrated. Question 6. Where should the nurse place the blood pressure cuff for an accurate reading? Directly over the elbow crease. 2 inches above the antecubital space. On the forearm. As tight as possible. The cuff should be placed about 1 inch, 2.5 centimeters, above the antecubital space, the bend in the elbow. Question 7. Which position is recommended to prevent SIDS in infants? Prone, on the belly. Supine, on the back. Side lying, on the mother's chest. The Back to Sleep campaign recommends infants be placed on their backs to reduce the risk of SIDS. Question 8. A nurse is assessing a patient's pain. Which is the most reliable indicator of pain? Increased heart rate, the patient's self-report, facial grimacing, crying. Pain is subjective. The most reliable indicator is whatever the patient says it is. Question 9. When should the nurse perform hand hygiene during client care? Only after the shift. Only after touching blood. Before and after every client contact. Only if the hands are visibly dirty. Hand hygiene should be performed before and after every client contact to prevent the spread of infection. Question 10. What is the priority action when a nurse discovers a medication error? Call the pharmacy. Complete an incident report. Assess the client for adverse effects. Hide the mistake. The client's safety is the priority. The nurse must first assess the client and then notify the provider and complete an incident report. Question 11. Which food is high in vitamin K and should be limited for a client on warfarin? Bananas, spinach, chicken, white bread. Vitamin K, found in leafy greens like spinach, acts as an antidote to warfarin. High or inconsistent intake can interfere with the drug's effect. Question 12. A nurse is documenting in a client's chart. Which is the most objective entry? Client seems angry today. Client is uncooperative during morning care. Client refused to take 9 o'clock medications. Client is having a bad day. Objective documentation focuses on facts that can be seen or measured, not feelings or interpretations. Question 13. What is the purpose of standard precautions? To protect only the nurse. To protect only the patient. To prevent the transmission of pathogens from both recognized and unrecognized sources. To save money on PPE. Standard precautions apply to all patients, regardless of their diagnosis, to prevent infection spread. Question 14. Which of the following is a symptom of infection in an older adult? High fever, acute confusion or change in mental status, hyperactivity, increased appetite. Older adults may not always run a fever. A common early sign of infection, like a UTI, is a sudden change in mental status. Question 15. A client is receiving a tube feeding. Which position should they be in to prevent aspiration? Flat on their back, head of bed elevated at least 30 degrees, left side lying, prone. Keeping the head of the bed, hob, elevated prevents gastric reflux and aspiration during enteral feedings. Question 16. What does NPO stand for? Nothing by mouth. New patient only. Nightly per order. No pain observed. NPO stands for nil per OS, meaning nothing by mouth. Question 17. Which pulse site is used during CPR on an adult? Radial, brachial, carotid, popliteal. The carotid pulse in the neck is the most accessible and reliable pulse to check during adult CPR. Question 18. What is autonomy in nursing ethics? The duty to do good. The duty to do no harm. The right of the client to make their own decisions. Being truthful to the client. Autonomy refers to the client's right to self-determination and making their own healthcare choices. Question 19. A nurse is using a walker with a client. Which is the correct movement sequence? Step, step, walker. Walker, weak leg, strong leg. Strong leg, walker, weak leg. Step and walker together. The correct sequence is to move the walker forward first, then the affected, weak, leg, then the unaffected, strong, leg. Question 20. What is the first step in the nursing process? Planning, implementation, assessment, evaluation. The nursing process steps are assessment, diagnosis, planning, implementation, and evaluation, ADPI.